The zone is treated on Su-Jok system of conformity to gynecological organs. Continuous mode, comfortable energetic level, 2 minutes. The additional zone in case of gynecological diseases is the inner surface of thighs. Here the modes can be combined. The back of feet is treated in individual dose mode. In case of male genital sphere diseases, the patient can be bothered by discomfort feeling, winning pain in the lower part of abdomen. There can be frequent urination or, in the contrary, difficult urination, sexual function breakage. In presence of these complaints, the pubic zone, perineum zone, ovary and sacrum zone is treated. In case of pain while urination, the treatment is held by the ureter channel course, directly by the penis course. Prostatitis. The infection comes into prostate by hematogenic way from any inflammatory source in the organism or directly from ureter in case of inflammation development in it or after instrumental examination. The painful and frequent urination, pain in perineum and sacrum, temperature rise is noticed with the patient. The prostate swelling can lead to sharp urination delay. Under the coarse influence of DENS and scanner apparatus, the clinic expressions disappear, the prostate decreases, urination recovers. First, the complaint direct projection is treated. Pubic, perineum, lymphatic, ganglions and others, in dose or continuous mode, on minimal or comfortable energetic level. Further, the lumbar sacrum zone is treated from the first lumbar vertebra till the last sacrum one. The asymmetry zones are revealed in individual dose mode. If they are found, the apparatus is transferred to continuous mode and the operation is held for 2-3 minutes. Mycolas rhombus is treated in individual dose mode. Further, the area of kidneys and ureters is treated. The apparatus electrodes are smoothly moved by skin in continuous mode on comfortable energetic level from both sides. The speed is 1 cm per second. In operation with children, it is necessary to follow the next rules. The smaller children are, the shorter must be the procedure. For the children of the first life year, the procedure lasts during 5–10 minutes, till the age of 5–6 years, till 10–15 minutes, up to 12 years, 25–30 minutes, minimal adult norm. Beginning from 12 years, the procedure is held on adult pattern, so to say, to 40 minutes. The next rule: the smaller child is, the less energetic level is used. With the newly born babies, the operation is held on minimal energetic level. If a child has an allergic dermatitis, or as it's usually called, diathesis, the skin zone, maximal revelation zones, intestines area and anti-allergic zones are treated. The allergic dermatitis or diathesis is an inflammatory skin damage resulting from outer factors' influence – chemical, physical, biological. Allergic dermatitis resulting from the facultative irritants appear only to those who are hypersensitive to them. Most frequently, the allergic dermatitis develop in case of repeated influences on skin of cleaning powders, cosmetics, insecticides, medicines, chrome salts, nickel and so on. In case of allergic dermatitis, the inflammatory phenomena in the damaged source are clinically similar with those in case of eczema. Hyperemia find the cycles, wetting crusts, shelling, and may spread over the skin area that was subjected to irritant. DENS and scanner operation leads to elimination of the skin irritation indices and to immunity increase on the whole. The operation begins on the areas of greatest skin damage. The apparatus is transferred but not pulled. The continuous mode, minimal energetic level. The operation is held during 30 seconds on each area. The elbow flexion is treated in the same way. The apparatus treatment of the liver direct projection area. Individual dose mode is held till the appearance of light sound signal. The energetic level is comfortable. The gallbladder direct projection is treated. It's the gall outflow method. The mode is individual dosed. Energetic level is comfortable. The intestine direct projection is treated. If the stool is normal or there is constipation, the operation is held spirally clockwise. If a child has diarrhea, The operation is held anti-clockwise. From the navel, the spiral is unrolled. The mode is continuous. Energetic level is minimal or comfortable. Motion is by 1 cm per second. In case of diarrhea, the spiral is twisted. The mode is continuous. The energetic level is minimal or comfortable. The speed of operator's motion is 1 cm per second. While treating the hormonal zone jugular pit, the apparatus is put on the angle to the body. The mode is continuous. Energetic level is minimal. Operation period is 2 minutes. The kidney and adrenal gland zone is treated from both sides in individual dose mode on comfortable energetic level. The 7th neck vertebra zone is treated in individual dose mode on comfortable energetic level. The common zones, 6 points and 3 tracks are treated each 3rd and 4th session. The 3-track zone is treated in individual dose mode on comfortable energetic level. The 6-point zone is treated in individual dose mode on comfortable energetic level. In case of catarrhal diseases, for example in case of rhinitis, the nose wings are treated in continuous mode on minimal or comfortable energetic level for 3-5 minutes. If a child has a sore throat, the treated zones are nose, tonsils, projection, submaxillary area, neck and thyroid gland zone. They are treated in individual dose mode. The painful areas are treated in continuous mode during 5-10 minutes. Further common zones are treated: jugular pit, the sternum zone and the 7th neck vertebra. The mode is continuous. Minimal or comfortable energetic level is held during 2-3 minutes. During the session, not more than 2-3 influence zones are treated. If a child has a sharp bronchitis, the session begins from the fishbone zone treatment. The operation is held slowly along the bronchial tree course upwards. The mode is continuous. The motion speed is 1 cm per second. The hormonal zones are treated each third session. The adrenal glands zone is treated in individual dose mode. The immunity area, 7th neck vertebra, is treated in individual dose mode. The tongue zone is treated in case of digestion tract diseases. The mode is continuous. The energetic level is minimal, 2-3 minutes.
При неврологических заболеваниях
In case of neurological diseases, the patient is bothered by headaches, dizziness, where may be nausea, vomiting, consciousness breakage. In such cases, the maximal pain place is treated. The apparatus is transferred by the hair part of the head after the hair separation. The sud-jaw conformity zones can be treated.
зоны соответствия по суджок.
Ischemia insult is a local ischemia of the brain, usually revealed by the sharp development of focused neurological damages. The ischemia of brain development can be caused by thrombosis or embolism of outer or inner skull arteries. In rare cases, by hypoperfusion of brain after systematic hemodynamic damages. The insult in 20–30% of cases is preceded by the transitory ischemia attacks, common breakages of brain blood feeding. Ischemia insult usually develops during several minutes or hours, rarely during several days, and reveals in movement, speech or other focused neurological damages. The breakages of consciousness, vomitings, intensive headaches are not noticed in most cases, except those ones where there is an infarction in the brain stem, cerebellum, or in case of broad hemisphere infarctions. In case of influence of DENS therapy on human organism, the arterious wall widen or recover, thus the brain blood feeding normalizes. In case of headache, the maximal pain area is treated till the decrease of elimination of pain. The mode is continuous. The energetic level is comfortable. Each point is treated from 30 seconds to 1 minute. If the pain is spread, the temple zone, border with the hair part of head, is treated. Forehead is treated in the same way. Then the hair is separated and the line connecting the nose bridge with the sound neck vertebra. The next treat line is the line from ear to ear for the head top. The mode is continuous, the energetic level is comfortable. Each point is treated from 30 seconds to 1 minute. The hand zone treated on Sue-Jock conformity system to the head and neck color zone. The mode is continuous, the energetic level is comfortable, 2 minutes. The apparatus operates on damage zone in continuous mode, on healthy zone in individual dose 1. If there is a left side hemiparesis, left arm and left leg are damaged, the damaged surfaces are treated in continuous mode. The apparatus operation begins from the fingertips, it stops on one point for 2-3 minutes. The extremity is treated from 2-4 sides. Further, according to tetrasymmetry, the sound leg is treated in dose mode from 1 or 4 sides. It's treated downwards. The apparatus operates on the ill extremity. The direction is upwards. The mode is continuous. The energetic level is comfortable. The speed is 1 cm per second. Then, the sound arm is treated in dose mode on comfortable energetic level. The neck color zone. The operation is held on minimal energetic level, moving apparatus with a speed of 1 cm per second. The operation time is 10-15 minutes.
При заболеваниях кожи в
In case of skin disease, the zones with maximal changes, where the rash is multiple, brighter or making a spot, are treated in continuous mode on comfortable energetic level. In this case, skin as a direct projection is treated on the square not more than the square of two patient palms. The rules are as follows. By the changed skin, the apparatus is not transposed.
переставляется.
Trophic ulcers can complicate the course of many diseases: sugar diabetes, thrombophlebitis, bed sores, and so on. The DENS and scanner apparatus operation in combination with melphalan leads to improvement of blood microcirculation around the ulcer. This encourages the skin damages and disease elimination and creation of fresh skin. The ulcer is treated on the injured body. The electrodes touch both damaged and sound surfaces. From session to session, the treated injure square narrows. The mode is continuous, the energetic level is comfortable or minimal. The apparatus is transposed. Stop on one point is 1-2 minutes. Do not forget about melphalan.
Для улучшения внешнего вида, для улучшения...
In order to improve the appearance and skin statement, it's possible to treat the face. In this case, two ways of influence are possible. The first way is the operation in continuous mode on maximal bone energetic level, in a mode of electric neurostimulation, when the symmetric parts of face are treated with the apparatus only transposed. In this case, the apparatus stands on symmetrical parts of face at the same time. The second way of face treatment is as follows. The face is treated by gliding movements on comfortable energetic level on the skin tension lines, on massage lines from the face central line to periphery. Around eyes, the apparatus is transferred from outer eye angle to the inner one on the lower lid and from the inner angle to the outer one in the upper lid. In case of obesity and cellulites, the treatment is held in continuous mode on maximal energetic level. The maximal change zones are treated on breeches, the front abdomen wall, on thighs. In this case, the apparatus is only transposed. Under obesity, the metabolism change is understood. It's characterized by the significant growth of fat tissue, increase of fat cells number and fat content in them. In case of little weight addition, it influences only the appearance, but a range of organs is also subjected to danger. The normal weight and conforming deviation from the average value are different depending on the age and neurological, endocrine and metabolism determined individual constitution. For its determination, there are various formulas. The simplest one says that the ideal weight in kilograms is equal to height minus 100. From the physiological point of view, in case of obesity, there is incoherence between received calories and physical work. In case of DENS therapy influence on the human organism, the metabolism increases, the activity of endocrine and neurological system improves, that leads to the body mass decrease and fat tissue decrease. The abdomen skin is treated by the cross method. The orientation is made on the navel and the apparatus constantly moves away from it. The mode is continuous. The energetic level is maximal. It is also possible to operate in continuous mode by radial slow movements in direction from navel. In case of cellulites, the operation is held in its direct projection. The mode is continuous. The energetic level is maximal. The apparatus movements are radial. Stops are made on the places of maximal fat formation. The operation is held in the same way on symmetrical areas. If a woman bothered by wrinkles, the apparatus operates on their maximal accumulation place in continuous mode on comfortable energetic level for 5-7 minutes. If the aim is to improve the face soft tissues tonus, the apparatus operates in dose mode, beginning with the face central line on massage lines, from the chin to ear, from the mouth angle to ear, from the nose wing to ear, and so on. If it is a young woman, the apparatus operates by massage movements. If it is an elderly woman, the massage movements are not used. Skin should not be tensed.
Среди заболеваний позвоночника наиболее...
Among the spine diseases, the most frequent are osteochondrosis of spine, different damages of carriage, kyphosis, scoliosis, kyphoscoliosis. There may be intervertebral hernias. In presence of these diseases, there are pains in the back frequently strengthening or appearing in motion. In this case, the maximal pain area is treated continuous mode. The rule is as follows. The stronger the pain, the bigger energetic level could be used in operation. In case of joint diseases, when the patient is bothered by pain, there may be swelling and blushing of skin over the joints. The treatment is held in the maximal pain zone in continuous mode, transposing the apparatus upwards. The ill joint area is treated.
больного сустава.
Deformation, arthroarthritis and polyarthritis. The inflammatory process occupates consequently the junction tissues of the whole body. First of all, in the area of joints. Into the inflammatory process, all the parts of joint are involved. The synovial membrane of joints thickens, becomes rough. The synovial liquid volume increases and sometimes significantly. The joints lose their calcium that provides their strength and hardness. The bone tissue destruction begins. At the same time, on the cartilages covering the joint joint surfaces, the unripe cells are laying. They increase the friction inside the joints and limit their moving ability. Often the disease begins slowly, and the common statement deterioration comes very soon. The patient loses appetite, loses weight and feels unsound. The pains in joints often appear in connection with some certain event. In